My name is Chris Pate. I'm a Director of Product Management with LexisNexis Risk Solutions Healthcare Team. I hope everyone's having a wonderful National Health IT Week. I think system interoperability and the move to value-based care are the trends over the past decade that I've been following closest. I think both those trends are really doing a good job of putting the patient first and trying to ensure great healthcare outcomes based on the sharing of information and frankly focusing on what the patient needs are. I'd like to see us continue in those directions. I know we have a long way to go, but I think we're certainly making some progress and I think it needs to continue. I would say my work is really crucial. What we do in the healthcare industry impacts so much of people's daily lives, and we need to provide timely and effective care to patients. Healthcare touches my family, your families, we've all been patients, and we all want the best treatments when we need them. We cannot forget in all this though, we are dealing with people and patients, and these aren't industrial widgets and these aren't systems for system's sakes. We have to be focused on providing good outcomes for the patients. How did I get into healthcare IT? Well, I got into healthcare IT through a very roundabout path. I have a background in history and architectural history, and although that might be far afield from healthcare, I feel that background allows me and provided me a broad understanding of how to make sense and incorporate a whole bunch of disparate information and use that information to explain situations and identify trends. Started in healthcare IT as a project manager with a large hospital in Central Virginia. And while I was there, I quickly learned firsthand the importance and the complexity of the healthcare IT system and its power to improve lives. So I'm very glad to be a part of this industry. Well, there's a lot of discussion right now around blockchain and its usage in identity management, financial record management, supply chain management, and even interoperability. I think we're still trying to determine what is the best use for that technology. I would say it's something similar with artificial intelligence and machine learning. I mean, we've certainly seen the ability to improve prevention and treatment options, but I still think we're in the early stages of both those fields of technology to understand really what's the most appropriate use for them within healthcare. I also think the ability to consider much broader social determinants of health factors to improve patient outcomes, such as economic stability, education, environment, community, and social context, can be very impactful to healthcare as well. The relationship between these factors and patient outcomes are very high. I find these relationships interesting because of my background in history, and we know that there are often conflicting and competing influences on health outcomes, and certainly the social determinants of health factors take those competing influences into account. Ideally, allowing providers to have a more well-rounded view of a patient situation to help identify which patients might need additional assistance outside a clinical setting is key to making sure that we have good healthcare outcomes for patients.